So I want to introduce Jen Doe. She works at Ginny's and she's a trichologist on the island. And we want to talk a little bit about hair loss in perimenopause and menopause and some solutions to that. And, Jen's mindful of information and she
Mhm.
can help us, with these issues that we're all going through at this moment in time. And if you're not losing hair, you will probably find different texture in your hair or, definitely changes in your skin, on your scalp and, and maybe within your hair itself. So I'm going to put some questions to Jen. But first of all, I want you to hear all about her and how fabulous she is and what she does on the island. So I'll pass you over, Jen.
Thank you, Jenny. It's awesome. Thank you so much for including me in your group and giving me all your questions. I've been a hairdresser for a long time, and over COVID, I decided to embark on getting my trichology degree. 2 years later, I'm still learning every day. The hair loss industry changes daily. There are different treatments available, for example, all the time. It's a continuing education. I've not stopped since I've started. And yeah, I love it. It's been amazing being able to help women with hair loss through, menopausal, perimenopausal issues. There are lots of things that can be done. And there's also a lot of snake oils out there, right? So
Right,
that's
right.
something that we want to avoid. You really need to get to the root, literally pun intended, of what is happening with the hair, because there's so many different types of hair loss too, right?
Right.
There's many different hair loss issues. So in order to help them, you need to, initially decipher what is actually going on with the hair, which it's a lengthy consultation that's involved to provide the best outcomes, basically.
So
Yeah.
how do you do that, Jen? When
So,
somebody so say somebody will book, they'll phone Ginny's. What's your number, by the way?
oh,
Just
yeah, sure. So I'm at info@rootsolutionsbda.com, my website. You can go through there, and there's a link to a questionnaire that people can fill out and send that to me. And then we create a consultation for them. I do, the first part of my consultation is done from home, either Zoom or WhatsApp video or whatever, where we discuss health matters, any things that people aren't really comfortable chatting about in the salon, whether you have PCOS or if you have a heavy menstrual flow, things like that we don't really want to discuss in front of other people. And then I would ask for your blood work and things like that. We go through, vitamin deficiencies and things like that. And then once that's done, we take you into the salon for the second half, where we look at your hair under a microscope. We do an AI generated beacon mapping, which is like it's showing your hair loss at this moment in time. It's amazing. It measures hair diameter per centimeter squared, and it really shows any improvements from the treatments that we give there and after that. So that, yeah, there are two parts to my consultations. Very important. I ask people to bring in, matter from their brush, for example. I look at those roots under the microscope to see if it's, to lead me down the path of whether it's a telogen effluvium or if it's a female pattern hair loss. And all of that is vital to fixing, the issues or
right.
stopping. Yeah.
Yeah, because with fluctuations in estrogen, when you get to perimenopause, what
Yes.
happens is, the estrogen can drop so
Absolutely.
much that your testosterone actually is the highest hormone, sex
Yes.
hormone in your body, which then can attack your hair follicle, can't it? And then
Yes.
that's one of the reasons why you do get the pattern balding in females.
Yes.
One
Absolutely.
of the reasons anyway, right?
Absolutely. There are so many reasons. So, the seven H's of hair loss, generalized, it's very specific, but we go through hereditary genetics, we go through hormones, thyroid issues, we go through general health, illness, surgery, COVID, fevers, We go through healing, any medications they might take, hassle, emotional stress is a huge for hair loss as well.
Right.
Your diet is very important, and your hairdressing practices as well. Over processing and things like that can also lead to hair loss. So yeah, there's lots.
So you've had your consultation, and what are the kinds of treatments? I know there are obviously various different issues with the
Yeah.
hair, but what
Mhm.
kinds of things would you say is general for, pattern balding, for example, in our,
Right.
our age?
Right. So for female pattern hair loss, I would say we would start with maybe offering a prescription minoxidil finasteride combination. If somebody isn't tolerant to the topical, we can also suggest, sorry, that they go to their doctors and ask for a oral prescription. Sometimes I prefer the oral minoxidil to the topical. Some people can get some scalp issues with the topicals.
Okay.
And we find that people, um, they find it easier to take a pill rather than the topical sometimes as well. And the topical minoxidil actually, once if it's a hair loss issue that we can wean you off the minoxidil eventually, then it creates less hair shed with the oral minoxidil versus the topical. Topical, you'll find a lot of shed, and there's some issues that you would need to stay on for life, and others that you would be able to be weaned off within a year or two.
Well, that's really interesting. So with
Mm-hmm.
the oral tablet, have you found it more effective, or is it just different?
Yes. Yeah, we actually find it 99% more effective than topical.
Wow,
And yeah,
it's
and
amazing.
especially they compound them with other things now, with finasteride or spironolactone combinations, which make the topicals more effective. But I prefer the low dose oral minoxidil. We use a very, very low dose, and the only contraindications to that would be obviously if somebody was having low blood pressure or high blood pressure. It is a off-label medication for high blood pressure. So that would just be something that you want to discuss with your doctor to see if your general health would be able to permit you taking something like that. The natural way would be saw palmetto, which is nature's minoxidil. That's another option for people if they didn't want to go the medicinal route. Um, Combine that with like low level laser therapy, which is amazing, amazing. I've seen such improvement on people just with combining with those one or two things together, can really turn around a hair loss, stop a hair shed, stop a telogen effluvium. You might find times where you're brushing your hair and you're like, Jesus, there's so much hair in my brush. And anytime we see things like that, we always go back 3 to 6 months, from to find the issues for like a telogen effluvium or just a hair shed. We look back in the past to 3 to 6 months to see what the what predeceased it, what made it happen. Female pattern hair loss and telogen effluvium you can have both at one time. So if you have, say, like a chronic telogen effluvium with more than 100 hairs coming out, yourself when you have more hair coming out than normal, right? And if that becomes from acute becomes chronic, that can also exacerbate any androgen related hair loss issues as well, and that you can have a combination of one or two hair loss issues at the same time. So yeah, it's very important. I think the most important thing is to address it as soon as possible. The better outcome you will have, the sooner you notice, and the quicker that you come in, the better the outcomes will be.
So you mentioned there about a laser. That's one of the
Yes,
other treatments that you do in tandem with the oral
yes,
minoxidil. So have you got the laser there?
yeah. So we have a medicinal grade laser at the shop that we use. It's a 20-minute twice weekly treatment. and it provides energy to the follicles to stop shed and keep you in the anagen phase. And I also bring in Revian hair caps, which are amazing for people that find that they can't, come in twice a week. Everybody's busy, right? So these caps you can use at home if you have coffee and tea in the morning, breakfast if you have 10 minutes a day, and it helps reduces inflammation on the scalp, and it also, helps with hair loss
So
massively. Yeah.
what is the laser and the caps? Is the caps like a red light therapy or something like that?
Yes,
Right.
basically, yeah, it is. And it just helps reduce inflammation and helps promote hair growth. And it is amazing, just providing a lot of energy for the follicle to grow hair. They are amazing. They're FDA approved for whatever that, gives you, right? But they've
Bermuda,
been
right?
very with no contraindications. They're very safe to use, and a definite frontline therapy for me to be used pretty much across the board with most hair loss issues.
So you said that this laser is keeping you in the what did you say? Androgen,
Anagen phase.
anagen. So
Anagen.
that's is that
Yeah.
the growth phase then?
Yes, that's a growth phase, and that's your aim, is to keep the hair into the anagen as much as you can. So like for example, when you use minoxidil, it people will find that they'll get like a little bit of hair shed in the beginning because it's taking your hair from telogen or falling out phase and putting it back into anagen. So you'll find there'll be a shed, which scares people because they're like, wait, I'm taking this for that. But it actually just starts to regulate it back to anagen, which is where you want to be.
So I heard that minoxidil is extremely poisonous to animals.
Right.
Is
Yeah,
that
you mentioned that. Yeah.
yeah? So if dogs lick you or your
Yeah.
cat licks you when you've got it on your head, it's
Yeah.
really poisonous for them.
Yeah.
So what
I
about the oral thing then? Is that's not going to cause any problems, right?
Well, as long as your doggies can't get to that. Again, so if you like for men, basically, if they are taking minoxidil and they're sleeping next to a partner who might want to get pregnant, those are some things we don't want to encourage the use of topicals. That's when we'd want to switch to an oral.
Oh,
I feel like they are very safe. They've been used for forever in Australia. I was on a course with some Australian dermatologists. Have been using it forever, and they've had no cardiovascular issues or anything like that. So it's been proven to be quite a very significant therapy for hair loss.
sounds
Yeah,
amazing.
yeah.
So when we go through the path of life, shall we say? I'm not going to say age. I hate that word. um, our cell turnover slows down with our
Yeah.
skin. That's why it takes longer for us to, heal.
Mm-hmm.
And your hair growth will slow as well. So how long
Absolutely.
have you seen a big reduction in, in that turnover, like you say, give it 3 to 6 months or whatever, is that a lot shorter time, sorry, a lot longer time for your hair to regenerate from, from say
Yeah.
like your 20s or whatever?
Yeah, I don't see, to be fair, much difference with age. Most hair loss issues, once we treat it with whatever we treat it with, we normally look to the 3 to 6 month mark. Even like I have 16-year-old male patients, we expect to see the same thing in a postmenopausal woman as we would a 16-year-old, believe it or not. Yeah. So yeah, between the 3 to 6 month mark is where we expect to see the progress. If we're not seeing any progress, we then will shift treatment plans. But yeah, I've had great success so far. The problem with me is I'm so excited for my clients to see their progress. Waiting that 3 to 6 month is painstaking.
I bet.
Yeah, it's great. But yeah, and most important too, the vitamin, nutrition, and all of that. We put everything together to make sure that your hair has the best environment to grow. If you have any psoriasis, if you have any seb derm or anything like that, that all needs to be treated because The scalp is like what gums are to the teeth. If your scalp isn't healthy, neither will your hair be. So those things have all also led to hair loss as well. So yeah, those
Interesting.
are
Yeah.
important. Yeah.
We recently had a really good session with Jennifer Lightbourne. I don't know if you know her at the North Shore Pharmacy.
Mm-hmm.
And she gave us this recipe for rosemary and
Lovely.
putting rosemary oil on your hair, on your scalp
Yes,
to
it's
help with, and
lovely.
and you can put mint and
Mm-hmm.
all these different stimulants really
Absolutely.
onto your scalp to really stimulate the follicle and nourish your scalp. Is there any
Absolutely.
other natural things that you can recommend, maybe to, like you say, give it that good foundation?
Yeah. I love rosemary mint. I think that that's amazing. People also, orally, I think, the fish oils are very important, like sticking to a Mediterranean diet, making sure you have enough protein, is also really important. And keeping good scalp health as well is very, very important. And in the vitamin, just wanted to touch on that really quickly. So the bloods that are most important to us as trichologists are vitamin D. Obviously, that's been proven hair loss relation to low vitamin D, B12, zinc, iron, ferritin, the iron storage, all are very important. So if any of those are low, then we encourage them, through vitamin supplementation as much as we can. If you're stressed, we love ashwagandha for things like that. And there are loads of hair, skin, and nail vitamins that you can get. I have some gummies that I use for retail in the shop for my clients, and I'm bringing in a new stress-related one soon with the ashwagandha in it as well, and saw palmetto as well. But for your hair, for treating your hair, if you have hair loss, the most scary thing that people don't want to do is brush their hair. It sounds crazy, but the more that they brush, they see the hair loss coming out. But anything you can do to stimulate your skin, your scalp, massage, providing blood flow to the area is all going to provide nourishment for the follicles to produce the best hair. So anything that you can do, keep brushing your hair, keep shampooing your hair. And
In the pharmacy, you can get these. I've got one upstairs. I should have brought it down, but it's like it looks like a brush, but it's got like really rubbery tips on it,
yes,
hasn't it? And
yes,
you can
yes,
put your
O'Shea, that's
shampoo in your
amazing.
hair.
Absolutely, that's so good. Any stimulation you can do is amazing. It all helps. Yeah.
Um, and what are the like kind of you know not just for hair loss,
Mm-hmm.
but I've found the texture of my hair has definitely got drier as I've got older.
Yes.
Well, I know I bleach my hair, but that's another
Yeah,
matter.
yeah, yeah.
I'm gonna dye my hair till I'm dead.
Hello.
But
Yes.
I've definitely found, and obviously with the grey hair that's coming through, the
Yes.
texture changes. Can you
Yes.
recommend any other things to, what should we be conditioning our hair with? Because I know things
Yep.
like certain oils, like I don't know, shea oil or whatever,
Mm-hmm.
can
Mm-hmm.
actually, get rid of the moisture in your hair, and it's not
Yes.
not always a good thing, right?
Absolutely. Well, I use British Science formulated trichology products, and I have a new line from Italy that I'm using as well, dermal, which is amazing. And they have like scalp treatments and hair strengthening treatments that I use, combining with the steam, oxygen, red light therapy. So you can just come into the salon and have treatments, and I can also provide you with things to take home and do yourself at home.
So what kind of
Um,
things is in it? Well, what's the ingredients in
in
these
the
products?
Brit Science line, well, there's all sorts of things. I can't think offhand
Sorry.
what's on the list because they're more medicated, they're more specific for hair related hair loss issues. So, but yeah, definitely, I would say the rosemary mint and things like that are amazing to use. And
And
if
what's
you
your
can, sorry,
sorry, God, sorry, go carry
go
on.
ahead.
What's your take on the microneedling as well?
Oh, amazing. I'm just starting a microneedling um, course of treatments for hair loss, actually. And it is amazing because they obviously the microneedling creates channels, on your scalp. It pushes in ingredients that you want to go in for hair loss. I use a product called Calisym, and it is amazing. It's got growth factors and stem cells, and it is amazing. And it helps to turn around hair loss in as quick as 12 weeks, which is huge, all with the microneedling. We don't go as far as like a facial where you'll see blood. We don't go that far down. We keep it on a very, very low level, but it makes a huge difference in pushing the treatments into the scalp. And I hopefully will have some before and after pictures I can show you once my clients have completed their cycles.
Amazing.
I have a lady writing a blog, actually. She's having the treatments done, and it will be on my website. So if anybody wants to check that out, that'll be amazing. I'm looking forward to seeing some amazing befores and afters with that.
So how big are the needles then in your microneedling? Do you know?
Yeah, they're just I think 0.18 millimeter or something,
Oh
but
wow, that really
we
is small.
really,
Yeah.
really, really, yeah, small.
Because
We
the
we,
one
we
the one I use for my face is zero point 0.3. So
yeah,
and even
yeah.
that's quite light. So that's a really nice.
Yeah, we try and do it as low as possible. We don't want to see any bleeding or anything like that. But it is a medical grade microneedling device that I have now, and I am super excited. I'm actually starting them next week, so I'll have in 6 to 12 weeks, hopefully a lot of befores and afters to show you,
That's
and I'll put them
amazing.
up on my website. Yeah, it's amazing. It's
So
amazing.
so what's been what kind of clients are you coming? I mean, you've mentioned everyone from like 16-year-old boys
It's
come.
amazing. Yeah.
So even in like postmenopausal women, say like, I don't
Mhm.
know, 60, 70 plus,
Yes.
whatever,
Yeah.
have you
Absolutely.
seen improvement with the treatments then?
Absolutely. I have ladies as old as, in their 70s, like, is there anything you can do for me? And I'm like, yes, there is, from 16 up. And that was, I think, the most amazing to me. I always wanted to treat women for hair loss, and I'm getting all these children, like young males that are like, oh my God, I have genetic hair loss issues, and I don't want to go the way of my dad. So I want to do something about it. And yeah, so yeah, the whole gamut, and see results in everything, in every age group, which is great.
Because it's very feminizing for women, isn't it? There's a lot of your not just appearance, but like your personality. I know for me, and people recognize me because of my
Yes,
curly hair, right?
absolutely. Your gorgeous curls. Yep,
So it's actually part of you, isn't it? It's a
it
big
is.
part of your who you are, really.
It's absolutely huge. I mean, I've cried with clients that have lost their hair with chemo. It is emotional. It's horrifying. It affects your self-esteem. It affects so much. And it's been great to be able to help people with those transitions now that I can help to treat people post chemo and post hair loss, hair transplantation. I do treatments for them as well, to keep the hair that they've gotten through the transplant. So yeah, it's amazing. It's
Wow.
amazing. It's amazing to make people feel so much better about themselves.
There's one more thing I wanted to ask as well about. I don't know about you. Once you click on one thing on Instagram or whatever, you get 10 bajillion adverts for it, don't you?
Yes.
I saw these hair toppers. Um,
Yeah.
you know, the,
Amazing.
the people who were going through that transitional period and still getting
Hmm.
treatment. What do you think about these hair toppers?
Love them. They're amazing. And if we get to a point with a person that we've increased their hair density a little bit, but they still want a little bit more fullness, they are an amazing option. They're amazing for people post chemo and people that just have super fine hair that want to beef up their hair. They're better than extensions, I think. they create less damage, and there's so many different options. I'm actually doing a course with a company. They will send them samples of people's hair, and then they will match them, and the look, it's just fantastic.
Wow. Is this
The
real
look,
hair? Is this real
yeah,
hair? Wow.
real hair. It's more, costly, obviously, but it's a viable option for a lot of people that just don't have as much, hair as they want, or they're in between treatments and they're just trying to, get through till we see some results with their hair loss. Yeah, I think they're very excellent, actually. Very, very good.
And maybe I don't know if you can recommend any companies at the moment, but yeah, definitely we'll put a
I'll
link.
post them up on my site because I'm
Yeah,
actually
do.
doing a course on them at the moment. And once I do, then I'll put them on my recommendation page, and so you'll be able to see. And if anybody needs any help with anything like that, I'm always happy to advise, for sure, especially with
Brilliant.
post chemo induced alopecia and things like that.
Yeah, I'll put the link up on our Peri Pals chat as well, just to let you
Amazing.
know where it is.
And obviously HRT, right? I don't know how you girls are feeling about that, but
I love it.
personally, I love it. I'm on it. I love it. It does amazing things for your sleep, like, just in general. And, when you're bringing those estrogen levels back up, it's only going to be doing good things for your hair. I
Yeah.
100% agree.
I mean, it's working for me definitely, but it's not for everybody, for
Yeah,
various reasons and
absolutely.
that. But at least there are other options,
Absolutely.
to
Yeah,
help this. And
sure.
it's amazing that you're doing this, Jen. I'm really
Yeah.
excited to see, what other things. Oh, we're going to run out of time. Um,
Oh, okay. All right.
hang on a minute. Let
Wow.
me kick that off. Yeah, thank you so much, Jen. This is
My
really good.
pleasure. My
And
pleasure.
I'll post all the links and
Amazing. Yeah,
yeah, we'll
that's great.
see what other options and different things you're going to be adding to
Yes. Yes.
your library of different.
Of services. Yes. Oh, thank you, Jenny. Thank you for
So,
having me.
thank you so much for your time. I
Actually,
know
are we
you've been.
still are we still recording? Are we off?
Oh, but I can turn it
No,
off.
no, no, no. Oh,
We're
you can
still
turn it off?
recording.
Okay. When you're ready. I was just to suggest, if you wanted to, you could come in and I can do the AI on you. It's a scan for your hair.
I would
And it's
absolutely
amazing.
love that. Absolutely.
Yeah.
I'll
Let
come
me know
in.
when give me half an hour when you have some time,
I will.
and message me, okay? And then we'll get you booked in for that.
Yeah,
It's
let's do
so
that.
fun. You'll love it.
Brilliant. Yeah, and I'll
Awesome.
report back.
All right.
Fantastic. Thanks, Jen.
Thank you. Thanks,
Take care.
Jenny. Take
Give the
care.
doggies a big scratch for me.
Thank you. Take care, darling. Bye.
Bye.